Hi, I want to take a couple minutes just to thank everyone for their participation in this process. As you know, we're setting our agenda for the next 12 to 24, 36 months, and we've asked you to be a part of this process. What I want to do for a couple of minutes is just talk about the crisis services that we have here in Wayne County. As someone that's new to the system, one of the first challenges that I noted was the problems that consumers had getting in and out of the emergency room. Some of the first calls from providers I had was from the emergency room, stating that some of our consumers were sitting 1, 2, 3 days in the emergency room because there wasn't a bed available, or because there was a process problem, or there was some issue that was preventing the consumer from getting where they needed to be. This wasn't just one hospital, this was several hospitals. And then the issue got compounded when we had the floods, and we lost one of our inpatient hospitals and took about 25 beds offline. That created even more pressure on the system. As I delved into the process and started looking to figure out what were the issues and challenges that we had, the very first thing that I noticed was we didn't have any crisis residential beds. We didn't have a crisis stabilization team. Part of that problem is probably because of the way the system is designed through the use of the MCPN. Each MCPN has their own process, their own rules, their own requirements for managing crisis services within the community. So this probably creates the very first barrier that we're going to have to deal with, either through standardization or centralization. But a lack of crisis residential beds means that consumers have to go have the only choice of going on an inpatient, as opposed to being treated in a least restrictive community-based setting. The other challenge that we ran into this past summer was the change with Healthy Michigan. Wayne County has invested heavily in the use of IMDs, freestanding hospitals. It's allowable under Medicaid as a reimbursement source. It was allowable under general fund, but it is not allowable under Healthy Michigan. Again, that takes more beds offline. The other risk that we have by relying on this mode of inpatient hospitalization is that Medicaid could also restrict its use sometime in the future. So long term, that's probably not the best solution for us. One of the things that I've started to do immediately was break down some of the barriers and to try to create some standardization in the system. And this is where you come in. There's a little bit that we can do at the authority right now, but it's real system transformation, real ideas and suggestions coming from you that we're asking for your support. We've created a position for a hospital liaison. That person is going to work directly with the emergency rooms and the MCPNs to help facilitate getting consumers out as quickly as possible. We're looking at alternatives for additional hospitals in the community, even going outside the community, trying to add bed space to take pressure off the system. We're also looking at setting a standard of 6 hours, a goal of 6 hours in the emergency room once a consumer is stabilized in the ER, to try to have them transferred to their next level of care within 6 hours, as opposed to 24 hours, 36 hours, or 48 hours, the challenges that we're currently facing. None of these problems can be fixed overnight, and we recognize that. And only through our community partners, through the hospitals, through the emergency rooms, through the MCPNs, through the case managers, the staff, the programs that all support these consumers, can we work together to find a solution that's going to work. Part of your challenge now is to take all of these challenges and figure out what is it that we can do. What are your recommendations as a community that deal with these issues on a daily basis in order for us to be successful moving forward? Thank you.